Hello friends, let's talk today about 24-hour pH study or pH with impedance study. If you are advised to take this test, this video will help you understand why you need it. The 24-hour pH test is an outpatient procedure performed to measure the amount of acid that flows into your food pipe or what we call an esophagus from your stomach during the 24-hour period of study. 24-hour pH or pH with impedance study is commonly used to help confirm the diagnosis of GERD, that is acid reflux, for the patients with typical or atypical symptoms of GERD. Typical symptoms of GERD are heartburn, pain in the upper part of your tummy, regurgitation of food and acid back to the throat. Atypical symptoms of GERD are chest pain, chronic cough and asthma, chronic sore throat, dental caries, etc. This test is specially needed when patients have the above symptoms of GERD, but the endoscopy is normal. This condition is called NERD, that is, non-erosive reflux disease. This test is often recommended for those whose symptoms of acid reflux are not improved by medications. This test is also very important for patients who are considered as candidates for acid reflux surgery. Actually, a 24-hour pH study includes two different tests, an esophageal manometry and 24-hour pH study. First, a manometry study is done, which takes about half an hour. Then a pH catheter is placed into your food pipe and is attached to a small device. This device will be attached to your body with a belt, and you go home with the device and the catheter in your food pipe and come back after 24 hours when it will be removed and the study will be completed. This is an ambulatory study, which means you can move around and lead your normal life while the study is being done. Now, let's first talk in short about the mechanism of swallowing and what might go wrong with it. When you swallow, food moves down your food pipe into your stomach with the assistance of a wave-like motion called peristalsis or contractions. If these contractions are weak or very strong or poorly coordinated, they may cause chest pain, heartburn, cough, or problems with swallowing. You may feel that the food is stuck in your chest while swallowing and may also flow back to your mouth when you lie down. In addition, the muscular valve connecting the esophagus with the stomach, called the lower esophageal sphincter or LES, prevents backing up of food and acid from the stomach into the food pipe. If this valve does not close properly after swallowing, food and stomach acids can enter the food pipe and cause damage, leading to a condition called gastroesophageal reflux disease, that is GERD or acid reflux. Also, if the valve does not open properly during swallowing, this may lead to a condition called achalasia cardia, in which you have difficulty in swallowing. Manometry gives the information about the esophageal peristalsis or contractions and also about the functioning of the valve. Thus, it will help rule out other esophageal motility disorders like achalasia cardia, which sometimes presents with symptoms similar to GERD. As treatment of both these conditions is very different, it is very important to differentiate between the two. Manometry is also mandatory to accurately locate the valve and guide the placement of pH catheter at the appropriate site. 24-hour pH study not only confirms the presence of reflux and gives information about the amount or severity of reflux, but it also gives the information whether your symptoms are due to reflux or not. We will analyze the symptoms you had during the 24 hours of study from the data collected when you have pressed the symptoms button in the recorder and correlate it with the reflux episodes. We then calculate a score which defines the probability of reflux being the cause of your problems. From these, we can predict the amount of improvement in your symptoms, that is your problems, after a laparoscopic fundoplication surgery. This test helps in proper patient selection for this surgery. Usually, poor outcomes of these surgeries are due to the poor patient selection, means doing surgery on those patients who have similar symptoms but due to causes other than reflux. The success rate of this surgery increases if this test is done as a part of regular evaluation before such surgeries. Finally, let me give you a brief idea what is pH with impedance test. It is done in exactly the same manner as pH study, but the catheter and the device used is different and the information it gives about your problems is different. The impedance pH catheter detects the reflux of both acidic as well as non-acidic fluid and even gas. Thus, it has the ability to detect reflux, which will be missed by a routine pH test. 24-hour pH with impedance is the preferred test for those patients who cannot tolerate stopping of antacid medications, which is required for performing a 24-hour pH study. It is also helpful if your symptoms are not improved with antacid medications. Hope this video is helpful in understanding why you need this test. To know how this is done, do watch our another video. If you have any further queries, feel free to mail me on drchiragthakkar1307@gmail.com or call on 079-2970-3438 to book an appointment. Wish you a good quality of life free of acid reflux.